I appreciate our regional media being available this morning to talk about the COVID vaccine rollout in Eastern Idaho Public Health's 8-county region. I want to give an update on the situation that occurred in our health district on Saturday as we opened up the priority groups to individuals 65 and older. And obviously it created a huge rush as well as many complications. So I wanted to explain that situation and explain the new process that we have in place for individuals to schedule a COVID-19 vaccine at Eastern Idaho Public Health clinics throughout our 8-county region. I will give everyone an opportunity at the end to answer questions. I also will have a document that I will share that is going live on our website as we speak to be able to explain in more detail the process that we'll be using forward. So I will go ahead and let me admit the next people coming into the waiting room and we'll go ahead and get started. So as I mentioned, on Saturday, Eastern Idaho Public Health made available appointments on a first come, first served basis. That is the day that we opened them up to the 65 and older population that were eligible in Idaho to receive the vaccine starting on Monday, the 1st. The population of the 65 and older in our 8-county health district is over 30,000 people. And that is a group of individuals that are very, very eager to get the vaccine. We did have appointments available that could be scheduled online through an app as well as on the phone. And within 20 minutes, we had about 2,000 appointments that were scheduled. We had significant problems with the app that was used for the online scheduling. That created enormous frustration and confusion, anxiety, and stress for people that were trying to use that process. And for that, we sincerely apologize. We never intended it to be a mad rush for the appointments that were available. We also made about a quarter of those appointments of the 2,000 available on the phone. And again, our staff were able to answer those phones and get those scheduled very quickly. That because of the overwhelming phone traffic, it overwhelmed our phone system and we were not able to get to the mailbox that told people that all the appointments had been scheduled. And so people just received a busy signal or were cut off at times. It wasn't until late into the afternoon we were able to clear all those calls out and get the message changed on the phone that the appointments had been scheduled. And again, the process that happened on Saturday did not turn out well, and we obviously learned many, many lessons from that. And so since that time, we have been working very hard to put a much more streamlined and simple process in place for the residents of our health district, and that's what I'd like to explain to you now. I'm going to share my screen. Oops. That's not the right document. Give me just a moment. I'm sorry, all this. I'm gonna just see if I can pull up the website because we should have all this on here now. Can someone give me confirmation that you're able to see the website?
We can see it, Geri.
Okay, thank you. All right, so if you click here on the schedule a COVID-19 vaccination, right from our main landing page, this is going to be our new process. And I actually do not see the document linked here yet, so we'll keep checking back here in just a moment. And again, give me just 1 second to see if I can get the document up to share with you all. I apologize for the technical difficulties. This is not the right one. Okay. Okay. Hopefully you can see this new document. It does explain that 65 and older became eligible on February 1st. I will just explain that appointments at this point are not only now eligible or available for 65 and older. Any individual a priority group, for example, a healthcare provider, a teacher, a child care worker, a first responder, those that were outlined through Idaho's priority groups are still eligible at this time to also receive the vaccine. However, everyone will be put through the same process for scheduling appointments here on out. So in order to make the process much more simplified, we have established a waiting list. And I want to explain right here that part of the problem that we ran into last week is that for probably a month or so, Eastern Idaho Public Health had been accepting names on a notification list. I think there was some misunderstanding by individuals that it was actually a waiting list and reserved them a place in line, but that was simply not the case. And so for that confusion, I also apologize. What we had intended that list to be is to be able to notify different priority groups when they were eligible to start receiving the vaccine in Idaho. And so throughout most of our 8 counties, a notification went out to those individuals on Thursday night that said 65 and older are eligible to receive the vaccine on Monday, and on Saturday we'll start accepting those appointments. Everyone that has signed up for that notification list already will automatically be included in the waiting list. Those signups will be converted to what is now a waiting list sign up. So people can register on our website, and I'll show you that in just a moment, to sign up on that simple online form. Also, people can call our office at this phone number. This is a new phone number that's been set up specifically for COVID scheduling, 208-533-3223. And we will have staff that are available if people are not able to access online that can enter them onto that waiting list. We do anticipate that we will have high call volume for the next several days as people that are not on that list already choose to get on that list, and we are working very hard to accommodate everyone as quickly as possible. If you call that phone number and no one answers, I would ask that people just leave a message and our staff will get back to you within 1 business day. Now, the process for going forward is once you're registered on that waiting list, that's where we're going to take names to actually assign appointments. And instead of having people call back into us, everyone that is included on that list as of 8 a.m. on Thursday, February 11th, will be entered into a computer-generated random prioritization and will actually be scheduled into an appointment for a COVID vaccine at Eastern Idaho Public Health's clinics for the coming weeks. We anticipate those clinics will start the week of the 15th because we've already scheduled those for this week and next, and continue likely through the end of March. But we will schedule out as far as needed to make sure that everyone is assured an appointment for a COVID vaccine. Sorry, I just need to add someone else from the waiting room. So what if you're not on the list by February 11th? And right here on this document, it says that anyone that registers on that waiting list after February 11th can expect to get a call later in the month. We're handling everyone that is on the list. We'll handle those first that are on the list through February 11th. And so our staff Our staff will start on February 11th, pulling those names, scheduling those appointments for the next available clinic in the county that was selected by the individual when they register, which is their county of residence. And we'll fill each of those clinics, then we'll go on to the next clinic. And that is going to take us several days to get through that process. We will be calling every single individual, texting or calling, whichever is their preference, on how they signed up. But we'll be notifying them of their appointment and confirming that appointment with them. And there's nothing else that people need to do. We understand that there is vaccine available at other locations. And so once we get everyone scheduled, that will be the worst case scenario as far as when you will have an appointment. However, it's very likely that you could be moved up to receive it sooner as we go through each of our clinics and people get vaccine at other providers. It will create openings. And so we will go to the next clinic and move those individuals up into the nearest clinic and just keep working that list day by day. And so it's very likely that people may get a vaccine sooner than what we originally schedule them. But at a worst case scenario, they will have a date and a time that they can expect their vaccine from Eastern Idaho Public Health. We're going to work through that process, as I said, and we expect it to take us through about February 19th to get everyone that's currently on the list slotted into an appointment. After that, we'll start working on those that signed up after 8 a.m. on February 11th. I guess I would like to stop there and ask what questions you have that I can clarify about this process that I've explained right here with the registration list and how the appointments will be scheduled.
Well, maybe show them on our website too, where that the registration list is.
So I was wondering, I know this also is for those in that priority group, and you have said in the past that there's roughly 30,000 in the 65 plus. Do you know how many people in the priority groups still are trying to get vaccinated?
Eric, I don't have an exact number. I can tell you that we started our vaccinations on December 14th in Eastern Idaho Public Health District's region through us, as well as many hospitals that were started doing healthcare providers. We have found that as more people were eligible, we had a busy season in the first little while of those new priority groups, but over time that settles down. If I had to guess, I would say the percentage of people in earlier priority groups is not significant. And I anticipate the majority of the appointments going to 65 and older.
Thank you.
Now, I would also say that, this is, and I think I might have skipped over this at the start. As of this week, we have been notified to expect about 2,500 doses of vaccine for our 8-county health district. And as we've mentioned before, there are roughly 40 locations throughout our health district, Eastern Idaho Public Health clinics, as well as other providers that are receiving that vaccine. And so as that allotment increases, more appointments will be available throughout our entire region as we are able to hold mass vaccination clinics and the providers get more vaccine to be able to serve people that they are seeing. We expect more and more people to get appointments every single week. I would say that the way that we have allocated the vaccine in our health district is based on the population of 65 and older within each of our 8 respective counties. And so we encourage people to seek out the vaccine in their county of residence. I will say, however, that we cannot prohibit anyone from outside of our health district from signing up to get a vaccine in our health district. Does anyone else have a question right now?
Health District Director Rackow.
Yes.
Thanks, this is Kyle from the Post Register. I appreciate y'all taking time to answer questions from the media. I wanted to ask about, seniors seem pretty dismayed about what happened this Saturday. And you talked about the health district, learned a little bit about the process and how to make it equitable. So I'm wondering if you could talk a little bit more about the lessons that you learned in any talks that you, other health district officials, and any state health department officials have had about how to make vaccine rollout more equitable for seniors.
Yeah, thanks, Kyle, for that question. And, as I mentioned, we were simply trying to make it equitable for everyone to receive the vaccine. And that's why we did it on a first come, first served basis. The execution of that did not go as we had envisioned. And obviously, there are challenges for seniors to access the internet, especially when they're competing with thousands of others and many the others that are much younger in age. And so we did make the phone calls available as well. But obviously, the lesson that we learned is our system was very quickly overwhelmed, and it took us some time to dig out of that hole that we created for ourselves. I certainly, again, am sincerely sorry for the stress that caused our senior population, because that simply was not our intent. I will tell you that after Saturday's experience, I did share a message on our website, and Mimi Taylor, our PIO, shared it on Facebook. Certainly we drew a lot of criticism, and potentially rightfully so. But I did share our experience with all of the other health district directors in our state, as well as the state Department of Health and Welfare leadership and the governor's office representative, so they understood what had happened here and that we were working very quickly to improve the process. We shared some of the limitations to the online app tool that we had used, as well as the process of people calling in. And I have shared with them also how we're rolling out this new plan. And we are all trying to share best practices with each other to make this process as simple as possible. But quite honestly, our major challenge is we have far more demand for the vaccine than we have supply. And so it is going to take some time for everyone to be able to get an appointment for the vaccine. But we simply do not want a repeat of what happened Saturday. And so that's why we are going to actually schedule clinics out through the end of March at least, and slot everyone for an appointment, and then be able to call those individuals back to alleviate that stress of having to continually try to call us to find out when they can get an appointment.
I have a question.
Yeah, who's speaking, please?
This is Ariel with Local News 8.
All right, go ahead, Ariel.
So I was wondering how, I know there are other places that people can go get vaccines. Let's use the fire department for an example. I know you guys will be giving them a certain amount of doses. I'm wondering at these locations, how many doses are going to be given to those groups, and how can people register to get an appointment with them?
So, to answer the first question, I can't tell you specifically as I sit here how many doses of vaccine each of the individual providers are going to receive. Obviously, as more vaccine comes in, it will be allocated more. The way that we have distributed the vaccine within our health district is that we are allocating for use by public health 1/3 of the doses. Private provider offices, so an individual physician office, so those are grouped together and they'll be allocated 1/3 of the vaccine. And then pharmacies and, for example, in Idaho Falls, Mountain View Hospital and their community care centers will be allocated 1/3. So three groupings: public health, pharmacies/hospitals that serve a broader community, and then a private provider's office is the third grouping. Now that varies from county to county because it depends on how many providers are in the county, as well as how much vaccine is allocated to that county based on that county's population of 65 and older. So that's the first question. I want to go back to my website just momentarily and show you where you can get that information. Are you seeing our website?
Yes.
Okay, so right here in the top hand corner, we have a list of providers that are receiving an allocation of vaccine in our health district. This list is changing frequently as providers come on and potentially as providers drop off of the list. We have done our very best to work with the providers to list on here the phone number that they want people to call, as well as a website or other instructions that they would like the public to use for reaching out to them to schedule an appointment. So for example, Mountain View Hospitals, they want people to email vaccine@mvhospital.net to schedule their appointment. I can tell you we had feedback over the weekend about Idaho Falls Fire Department. And because of staffing not being available over the weekend, their website was not updated, but it is updated now with a phone number that people can call and their instructions on how they want people to schedule. So as things change, we will continually update this list. But this is the information to the best of our knowledge as it sits here today. And again, we will put the date it's updated because I do anticipate it will change frequently.
Thank you.
You're welcome. Any other
Director
questions? I'm sorry.
Oh, sorry. Kyle with the Post Register. I wanted to ask what other states and what other models you looked at in developing this sort of lottery system. And I'm wondering in talks with state and other local health officials, what they're looking at. Is this going to be something we're looking at statewide that officials are looking at?
No, Kyle, I can tell you that we've looked at a lot of options for rolling this out. And obviously there is no perfect system. We're seeing those challenges across the nation and across our state. We are simply trying to do the best process that we can manage within our health district. What we've changed to is obviously going to be very time intensive for our staff, but we're committed to making it as simple as possible for the residents that we're trying to serve. And again, sharing best practices with each other to improve everywhere we can.
This is Eric again with East Idaho News. Is there any talks about when the allocated doses will increase, or is that just playing it by ear?
Yeah, there is no definitive answer to that, Eric. Again, we're now getting a little bit more vaccine than we did 2 weeks ago, which is encouraging. But we don't have any idea what that looks like in the coming weeks.
Thank you.
Director Rackow, I wanted to clear up a question I had at the beginning. So what happens if someone doesn't show up for their appointment? How does their appointment go and what's that process like?
Yeah, very good question, Kyle. And I'm going to go back to the document and keep walking through that because that does answer that question. Before we get there, I'm sorry, I have the wrong document again. It's very challenging here. So let me just walk through the rest of the process of how this will work starting February 12th, as we do that random computer generated listing. We'll just start at the top of that list and start slotting those individuals for appointments and start reaching out to them to schedule them for their appointment. And are you guys seeing the document on the screen?
I'm not.
Okay, sorry. Let me try again. How about now?
Yes.
Okay. Please forgive me. I got the wrong one again. Hopefully this is it. Okay, so once we get the first clinic scheduled, again, if people chose to receive a text from us, they will get a text with this language that they've been selected to receive a vaccine from Eastern Idaho Public Health on a specific date, and that our staff will be calling them that day by 5 p.m. to provide them with the details on their appointment. If they have already received the vaccine somewhere else, they can simply reply to that text saying no, that they don't need the appointment, and we'll take them off of our list and move to the next person. If people chose to receive a phone call from us, again, we will simply call them by phone, and this is the number that will show on the caller ID, so people can be watching for that, because we do know that individuals, if they don't have a contact, they may not answer the phone. And so we're just trying to make it as simple as possible of what people can expect going forward. The thing that we have chosen to do is that because spouses can register independently on our waiting list, but as we call to make appointments, if say we reach a husband, if his wife is also eligible, we will schedule them at the same time to be able to go to the clinic together. And then there's just more information people can read here of what to expect as they prepare for their appointment, what will happen at their appointment, what happens after their appointment. And now I wanted to get into the Q&A because this answers some of the other questions and the one that Kyle just asked. So we have explained on here that we have been successful in administering every single dose of vaccine that we've had at our clinics. And we will continue to do that. We don't want to waste one single dose of this very valuable vaccine. And so the process will be, and it happens sometimes, right? That people may come to a clinic and unknowingly, perhaps they had a vaccination in the previous 14 days and that was not disclosed. And so we couldn't tell them that they weren't eligible at that time. But if for some reason people don't show up or not eligible to get it that day when they do show up, our process will be, we will have the list of people that are scheduled for the next clinic in that county, and we will start calling from the first person on that list and see if they can come in immediately to get the vaccine. And then we would just adjust that next clinic schedule, move people up that list. So we'd be pulling from the next schedule, the next clinic, pull people if we have extra doses at the end of a clinic. Does that answer your question, Kyle?
Yes, thank you.
Okay. So again, there's a couple of reasons why people cannot get the vaccine, and it's because if they have had any other vaccination in the past 14 days, or if they're currently sick with COVID. Obviously, people should be isolating if they're sick with COVID. However, if we call someone because they've been selected for an appointment time and they have one of these situations, we will work with them to schedule them into a clinic that meets the timeline that they're eligible. They won't just be dropped off. We will ensure that they get an appointment at some point. There is no cost to receive the vaccine. Eastern Idaho Public Health will be, we do charge administration fee, and we will bill that to individuals' insurance. So if there's private insurance, we ask people to bring your insurance card. For those that have Medicare, they need to bring their Medicare card, and it's the red, white, and blue Medicare card. It's not their Medicaid Advantage or a supplement card. It's their red, white, and blue Medicare card. However, if people do not have insurance, there will not be an out-of-pocket cost to them to receive the vaccine. We have a couple of other questions on here that that we get asked a lot. One that I want to share right now is if people receive a vaccine at another provider, they cannot come to us at this point in time to get their second dose. People need to return to the original provider where they received their first dose, and that is because the second doses are automatically shipped to those providers to administer the second dose to those that they had the vaccine for first doses. Sometimes we find that there was a problem potentially with a provider, and if that's the case, Eastern Idaho Public Health will work with that provider to see what we can do to help them. But individuals need to return to the provider where they received their first vaccine. I had something I wanted to show up here. And Again, I have to apologize because something crossed my mind when I was talking and it's now escaped me again. Oh, yes, I remember. So when people come to one of Eastern Idaho Public Health's vaccination clinics, before they leave that clinic, they will automatically be scheduled for their second dose. They will have their vaccination card, and we will write on that card the date and time of their next appointment. So there's no need for them to worry about getting that second dose. And as we've reported before, second doses are being automatically shipped to us, to the state, as well as to us, Eastern Idaho Public Health, and for us to allocate to those providers that are getting the vaccine. So at this point, there's no concern that people will not be able to get their second doses. What other questions do you have? I'd like to go back to our website and show you a couple more things. Again, this just went live moments ago before we started this briefing. So from our main landing page, click on Schedule a COVID-19 Vaccine. It explains the new process. Right here, people can click to get that document that I was just showing you. And then right below here, and we'll still be working on this a little bit, people can just simply click on their category and fill in a very simple registration form to get on the waiting list. All we ask is the county of residence, their name, their age, the phone number, and how they want to be notified. And then that's all they need to do. We will then reach out to them. On the same page, if you're not 65 and older, there's another registration form, but as I mentioned earlier, it all goes into the same pot for that random selection of appointments. But people that are eligible right now to receive the vaccine are listed right here on that form, and we just ask people to select which group they're in as they submit it. And same thing, their county name and phone number and how they want it to be, how they want to be notified by us. I'll say again that everyone that is that has registered for our notification list prior to today will be, or very momentarily, will be receiving a text or a call from us confirming that they are on our waiting list, and that we will be reaching out to them to schedule when we have an appointment available for them, and then directing people to our website or our phone number to call if they need more information. So there's a couple questions in the chat I'm going to look through quick. Again, the phone number, and I'll just explain here that while we have offices in 8 counties, we are doing a centralized COVID scheduling process out of our Idaho Falls office. And that phone number is 208-533-3223. And staff will be answering those phones. Again, we expect that it will still be very busy with callers calling in over the next days. So we ask for patience, and you should be able to leave a message if someone is not available to answer your call. We'll return your message within 24 hours. And then just to be clear, people contact the health district or one of the providers to schedule an appointment. And the answer is yes. And we recognize that people may be getting on multiple waiting lists, and that's okay. All I can speak to is our process at Eastern Idaho Public Health. And again, we will be confirming, we'll be scheduling everyone's appointments out through the end of March, or however long it takes to get everyone an appointment that's on our list as of 8 a.m. on February 11th. But then we will be working that list every single day. People will be moving up. We know people will drop off, and so we'll just keep moving those people up to get them in that order that their name was drawn. And so Kyle says, essentially, it's a lottery system, and basically, yes, it's a randomly generated priority list for everyone that has signed up. After the February 11th date, we will anticipate again scheduling those people at the tail end. And we hope at that point that just as people register, we'll be able to then just schedule them for a clinic, that we won't have to maybe have the waiting list going forward. And I will say that on our website, there is a third link for people that are coming up next Idahoans eligible to get the vaccine. We'll add that registration form on there today, but we won't be doing anything with that group for the time being until we get closer to opening those groups up as assigned by the governor. So what other questions do you have that I could answer for you this morning? It's a quiet group today, and that's okay. I would just want to once again apologize for the chaos that was caused on Saturday. That was certainly not our intention, and we are doing our very best to make it much more simple for individuals, and that public health will reach out to everyone that is signed up on that waiting list before the end of February. So we ask for your patience as we work through that process and get people scheduled. But you can call our phone number 208-533-3223 for any questions. But again, once you're registered on our waiting list, Eastern Iowa Public Health will reach out to you when we have an appointment available for you. And
Really quick.
one more question, sorry. If people have not gotten on the waiting list, so Brandon has asked, if people haven't gotten on the waiting list yet, should they wait until the 11th? And the answer is no. From now until the 11th, everyone can register on that waiting list. But what will happen at 8 a.m. on the 11th is when we're going to pull all those names and do the random number drawing and then start scheduling individuals. So people can get on that list now. And Mimi had a comment?
Yeah, I was just seeing a question online on East Idaho News, this thing of any accommodations for people who are blind or do not drive.
The question that came from East Idaho News on their online was, are there any accommodation for people that are blind or cannot drive? And I will tell you that when we reach out to individuals, if they, excuse me, need an accommodation, if they would please let our staff know. In Idaho Falls, we're working closely with Idaho Falls Fire Department to try to serve the best that we can those people that are truly homebound and provide that assistance. We can certainly work with providers in other areas that may be able to provide those accommodations as well, but we would just ask people to let us know that when we reach out to them to schedule their appointment. So the document that I just showed a little while ago, again, is live on our website now. I'll just show you once again where that is. So if people are wanting to look for it, click on from our main landing page, schedule a COVID-19 appointment. Here's just a brief introduction of the process, but that full document can be accessed right here. Any other questions this morning? All right, I thank you so much for your time and for helping us to get this information out to our communities. We are working very hard, as is every other COVID-19 vaccine provider in our region, to get the vaccine into people's arms as quickly as possible. We are certainly looking forward to the day that our allocation increases and we can move through these much more quickly. But in the meantime, we do ask for people's patience as we as we try to navigate a situation that unfortunately we just don't have enough supply to meet the demand. So we're doing our best, and as more vaccine becomes available, we'll get more and more people in. And if you have questions or concerns, please always feel free to reach out to us at Eastern Idaho Public Health. So thank you very much for your time this morning.